A warm welcome to you. Today is really a special occasion. We have several live events on our Facebook page, the Digital Scholar, the Facebook page of the Geneva Learning Foundation. This is the second live we're doing, collecting case studies on country experiences with designing, developing, establishing electronic immunization registries. So we're very pleased. In a few minutes, in just under 3 minutes, we'll be speaking with Karen Broome. She is the former National EPI Manager of Barbados and currently working out of the sub-regional office for PAHO based in Barbados. And she's going to tell us about one really, really important aspect of what is required, what it takes to deliver a successful electronic immunization registry. So if you're an immunization professional and you're in any way, shape or form interested in EIR, there's of course a course starting Monday, but whether or not you are in the course, you're welcome to join this event and learn with our guest, Karen Broome. See you in a few minutes. Welcome, this is Reda Sadki from the Geneva Learning Foundation, and we're recording a case study today for the Electronic Immunization Registries from Planning to Implementation, a course from the Pan American Health Organization, the regional office for the Americas of the World Health Organization. I'm here with Karen Broome, very pleased to welcome her as our guest today. She is the former National EPI Manager of Barbados. So the EPI is the expanded program on immunization, and currently working in the sub-regional office for PAHO based in Barbados. Karen, could you tell a little bit more about yourself and introduce yourself, who you are, what you do, and what has been your role in establishing the Electronic Immunization Registry system in Barbados?
All right, so good morning or good afternoon, everyone, depending on where you're from. As you've heard, I am Karen Broome. I was the EPI manager in Barbados. I'm currently on assignment as the immunization advisor for the Caribbean sub-region. I was the EPI manager in Barbados, and as such, I was very fortunate to be on a team that coordinated and managed the implementation of our EIR, which was within the greater implementation of our patient management system. I am a doctor, a clinical doctor by profession, and then went further on to study in my master's in public health.
So, can you tell us about what, in your context, what triggered this initiative around establishing an electronic immunization registries system for the country of Barbados?
In Barbados, we recognize that electronic registry was the way to go. Number one, a paper-based registry can fit your needs up to a point, but then the coordination and the integration and the smooth communication back and forth from secondary care to primary care and with from the community back to the ministry was definitely be facilitated by an electronic registry. We needed information at our fingertips. We needed to be able to access records easily and in order to make decisions about programs and plans.
Can you tell us about your role? And we're specifically interested because as a national manager for the entire immunization program in the country, how did where did the EIR project fit in? And what did you do from that national management perspective that's important for other API managers who may be listening in to understand?
Right. So the specific role really was to coordinate all aspects of the EIR implementation, which included from just sensitization at the very beginning to training all levels. So training from the ministry through to the operators in the community, whether it be the nurses, the doctors, everyone that would be the records officers, everyone that would be required to use the system. And then, of course, liaising with the technical team, because the technical team has one idea, but then when it gets on the ground, how are we managing with it? Is it working how we thought it would? So a lot of feedback, both from the technical team, from the team on the ground, the operational level. So a lot of coordination and listening to the staff in the polyclinics, or what we call our health centers, who are using the EIR, and then listening at the managerial level in the ministry. What do we need to come out of the EIR? So a lot of coordination and listening and feedback and going between each of the groups.
Understood. Let's talk about the case study then. We asked you to think of a time when you solved a problem or had really a significant breakthrough. Can you tell us what that time was and what happened? What was the insight or the Eureka moment that you that changed how you were building this electronic immunization registry for Barbados?
Right. The Eureka moment for me was it came through the training. Training was done by the technical staff. So you train the nurses, the doctors to use the EIR. But training in a sterile environment, then you go into the clinics to use this EIR. And it is a different state when you're in an environment where you're learning this step comes after this step, and then you're transitioned to an environment where you have a patient in front of you, there are many, many, many more patients outside waiting on you, and you have to get it right. You have to be able to go through the process. And a lot of persons are comfortable doing what they always did. So they were comfortable using the books, comfortable using the registers, comfortable using the paper. And when the pressure's on, people go back to what they're comfortable doing. So when the pressure came on, the system became a concern and persons started to slip back into doing the paper. So how could we get persons to see the benefit of the EIR and not slip back into what they were doing before? And one of the major challenges was that persons are concerned that when you put things into a computer, it will be lost. When electricity goes, it will be lost. If something happens and they click something wrong, it will be lost. That their concerns are always with the backup. The other thing that is a concern is that this is not fast enough. I need to do something I'm accustomed to, so I'm going to do it with the paper because I'm faster with the paper. So those two were some of the major challenges, and I found that it was not enough for technical people or persons from the ministry to go and say, hey, this is going to be faster. You just need to get accustomed to it. Or, hey, we have a backup and this backup will work. It wasn't enough. People were not convinced. So what we realized is that there were staff that were committed to seeing this EIR being successful. And there were staff at all levels: nurses, doctors, records officers, persons in the ministry. And we use these persons as champions. So as a champion, your job was to go to all of the persons in all of your colleagues and show them how it benefited you to use the EIR. Show them how, look, the electricity went off. We didn't have anything overnight, but look, when I come in this morning, everything's still there. All of your information is still there. I have 50 children outside waiting, but I got through even faster than you did using paper, and I used the EIR. So when they saw their colleagues and the benefits that their colleagues got from using the EIR, they were then more interested, more enthusiastic about using it, and also getting those benefits for themselves.
Fascinating. So how did this approach of finding and calling on champions, how did it turn out? And was there anything that surprised you?
Using the champions, it was effective. I can't say that we managed to get 100% of people on board, not at that time, but as we moved further and further on, then more and more persons came on board. But the champions really helped push us over push us over into the majority of persons being involved and seeing the benefits. So also, it is important to know that with the EIR, you are nothing without the personnel who have to use it. You can have the best EIR in the world, and if your personnel, if your staff are not invested, then it isn't going to work. So a lot of our resources and energy were aimed at the staff and having them invested in the EIR, showing them the benefits, promoting the benefits, showing how it would work, showing them, look, every month you can go and do your stock count instead of having to stock count every week, because we have a tally that we know is accurate. So there are different ways that we promoted it, and always through the champions.
That's a wonderful, very detailed and specific testimony. Thank you so much, Karen Broome. One last question as we close this case study. What would you like to say to your fellow national EPI managers who are at whatever stage they may be in wrestling with electronic immunization registries? What would be your advice?
My advice is that the staff always look to you. Your attitude and how you view the EIR makes a big difference. If you are enthusiastic, if at every chance you get to speak about it, you do, if you show them how it benefits you, them, and the country every time, then you will get their support. But it is important to get their support from the start and show them that you are invested. You know that this is going to make it easier for them. It's a benefit to the country in terms of the job they do on the ground, in terms of the country reporting. But you have to show that you are invested and enthusiastic about it.
Thank you so much, Karen Broome, for sharing this case study and sharing your experience and expertise as the former National EPI Manager of Barbados and working for the Pan American Health Organization currently. That's it for this case study. We have more case studies coming, so if you have not joined yet, or if you have any interest in electronic immunization registries, whether or not you were selected for the PAHO course, we hope that you'll be able to join us for these live chats and case studies about electronic immunization registries and find them useful to your work. Thank you once again and see you soon. We have a lightning chat coming up right after this one.